Safe and affordable housing is what shapes the environment in which an individual matures and develops and plays a large role in the social determinants of health for those who are unable to obtain such housing. Social determinants of health are defined as the structural determinants and conditions in which people are born, grow, live, work, and age, and therefore can greatly affect one's quality of life. Specifically, housing is a very important determinant to consider because without a safe and healthy living environment, it will be hard for the people living in such conditions to lead a happy, healthy, and successful life in the future.
Living in unsafe housing conditions is related to a myriad of poor health outcomes that is affecting the lower income residents of Baltimore. For these families of lower socioeconomic status, they are more likely to live in housing with inadequate ventilation systems, inadequate heating, and inadequate stoves that leak. As a result, they are more exposed to airborne diseases, illnesses, and air pollution. However, the most prevalent health issue with unsafe housing in Baltimore is lead poisoning in children. According to the Green and Healthy Homes Initiative, lead poisoning continues to undermine the health, economic, and social outcomes for so many of our communities, our families, and most importantly, our children. Every year, 535,000 children under the age of 6 in the United States are affected by lead poisoning due to the housing that they live in. For families of lower socioeconomic status, they often live in old apartments or row houses that often have significant levels of lead-based paint that affect children the most, as even the smallest amount can hurt the developing brain. More specifically, lead poisoning has been shown to decrease children's reading and learning abilities, making them 7 times more likely to drop out of school than their peers. Aside from education, lead poisoning has been shown to induce hearing loss, speech delays, aggressive and violent behavior, and long-term health effects that affects the kidneys, heart, and brain. Under Dr. Lena Wang, the Baltimore Health Department has already begun taking steps to reduce lead poisoning, but it's essential that they begin working with the Baltimore Housing Department as well to address the roots of these lead poisoning problems, which is old and dilapidated housing that these lower income families are living in. Implementing lead prevention strategies in Baltimore, and frankly, the entire United States, is important as not only will it reduce adverse health outcomes in children, it will benefit the economy financially. For every dollar invested in lead poisoning prevention, taxpayers will receive $17 to $221 in return. In addition, the United States currently spends $50 billion treating long-term health effects of lead poisoning. If we were to reduce lead poisoning and these long-term negative health effects in children, the U.S. could also significantly reduce their health-related costs. Finally, our nonprofit, Ever Homes, has partnered with Green and Healthy Homes Initiative to develop a comprehensive strategy to decrease lead poisoning through an integrated housing intervention framework, where we focus on policy changes to support the creation of healthy, safe, and energy-efficient homes for lower-income individuals.
The social environment of one's neighborhood has a significant impact on one's current state of health as well as future health outcomes. Repeated exposure to violent crime, often presenting itself in gang-related violence, can take a cumulative toll on health as this is an environmental stressor. This subsequently leads to a higher risk of mental health problems related to stress, such as anxiety, depression, fear, and mistrust, often escalating to PTSD and substance abuse. This environment promotes risky behaviors because residents of crime-ridden neighborhoods perceive themselves to have relatively short life expectancies, leaving them less concerned with the long-term health consequences of their actions. As for behavioral outcomes, violent and unsafe neighborhood environments have been linked by several studies to worsened child cognitive and behavioral development, increased rates of school dropout, lesser educational attainment, more involvement in crime and delinquency, higher incidence of substance use, and unsafe sexual activity, along with a lack of contraceptive use. Ultimately, these high rates of stress present in unsafe neighborhoods, as well as the resulting scarcity of healthy role models, affect long-term physical health status of adults. Consequently, these adults experience higher incidence of coronary heart disease, high blood cholesterol levels, inadequate respiratory function, obesity, and high blood pressure. These adults are then more likely to give birth to infants with relatively low, unhealthy birth weights. Youth gang involvement is promoted in neighborhoods where gang violence is already high. This generally leads to even higher rates of risky behaviors, such as alcohol and drug use, aggression, poor school performance, family disorganization, broken homes, delinquency, and overall feeling unsafe in one's own neighborhood, which serves to just continue this cycle. Close-knit neighborhoods have been shown to harbor substantially lower rates of risky behaviors by their residents. Specifically, neighborhoods in which residents express mutual trust and share a willingness to intervene for the public good have been linked with lower homicide rates. Residents of these neighborhoods are more likely to work together to achieve common goals, such as cleaner and safer public spaces, healthy behaviors, and good schools, to exchange information, such as regarding childcare, jobs, and other resources that affect health, and to maintain social controls, such as discouraging crime or other undesirable behaviors such as smoking or alcohol use among youths, drunkenness, littering, and graffiti. Social cohesion is highly lacking in neighborhoods with gangs due to their inherently divisive nature.
Generously, Baltimore's Broadway East neighborhood can be described as grim. The crime rate is over 4 times the national average. According to the 2010 census, the median income of $23,000 a year hovers near the poverty line. Rows of vacant houses, which account for 35.8% of all units, slant and lean like old gravestones. Still, this is not a neighborhood without hope. After the riots in 2015 further decimated the area, buildings and neighborhood institutions have been rebuilt. In November, the Baltimore Food Hub opened the first building of its Broadway East campus, which will bring jobs and healthy food to the neighborhood. Our proposal focuses on Broadway East because we think that it lies at the confluence of desolation and opportunity that would allow us to make the maximum possible impact. This is a neighborhood that's been forgotten and ravaged by time, but one that through corporate initiatives and the will of the people holds promise for the future.
Now, more specifically, I'm going to give you some information on Ever Homes. As noted earlier, close-knit neighborhoods are highly correlated to lower rates of risky behaviors by their residents. In order to ensure that our proposal has the maximum possible efficacy, we are aiming to provide high-quality housing to a small number of people, rather than mediocre or subpar housing to a high number of people. To this end, Ever Homes will select one block in the Broadway East community, which we will rebuild and rehabilitate. We estimate that we will be able to provide approximately 20 subsidized housing units to low-income residents. However, we recognize that this is only one leg of the four-legged stool, which is the theory that it is necessary to take 4 social determinants into account for a community to be truly healthy. Other legs of the stool include access to healthcare and healthy foods, a decent public school system that prepares students for today's economy, and livable wage jobs. To address each of these points, we will partner with other organizations whose missions tackle these goals. To address healthcare, residents will be connected to Chase Brexton, a Baltimore-based healthcare clinic that works to ensure that everyone in the community has access to affordable, all-inclusive healthcare. To address decent public schools and livable wage jobs, residents will be connected with Baltimore Workforce Investment Board, Maryland Department of Labor Licensing and Regulation, Department of Vocational Rehabilitation, Unemployment Insurance and Trade Act programs, the Baltimore City Department of Social Services, and Baltimore City Community College. By addressing the issue of housing and connecting residents to other organizations committed to the betterment of the community, we will implement a comprehensive plan to improve the standard of living for the community.
To avoid wasting any funds, our plan is centered on first fixing one community and measuring our success before initiating our plan on a larger scale. As discussed by Pavan, our plan is focused on rehabilitating 20 homes total. For these 20 homes, it is important to distinguish between homes that need to be demolished and rebuilt and homes that should just be rehabilitated. Vacant structures lower the values of the surrounding properties, which in turn plunges property values and increases municipal costs. As a result, demolition would increase property values, which would lead to more stability, fewer foreclosures, and lower municipal expenses. However, demolition must be done selectively and with a purpose. If a house is past the point of saving, it should be demolished and rebuilt. In other cases, rehabilitation works better because property values are higher next to a rehabilitated house than next to a vacant lot with a garden or playground. Therefore, we estimate that of these 20 homes, 70% would only require rehabilitation, and the other 30% would need to be completely rebuilt. As a result, 14 homes would require $15,000 each to rehab, and 6 homes would require $50,000 each to rebuild. In total, it would cost around $510,000 to create 20 functional habitable homes.
Factors that poor quality housing perpetuate include the things aforementioned, such as health issues caused by lead paint on the walls of one's home, unsanitary living conditions, and indoor air pollution, as well as increased risk of PTSD and long-term depression due to living in crime-ridden neighborhoods. Such factors impact one's overall well-being and livelihood, which is what makes healthy and affordable housing such a large part of one's social determinants of health. Such detrimental health and social factors should never be things people should have to live in fear of in their own homes.